Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome back, and thank you for joining me for this week's episode of the Healing Pain Podcast. Today, we're discussing how social determinants impact health and disease. My guest this week is Dr. Laura Kaiser. Laura is a physical therapist and a public health consultant with expertise in pelvic health and child health and development. She is a seasoned researcher, writer, speaker, and educator with an interest in reducing health disparities, improving population health literacy, advocating for gender equity, as well as human rights. She received her master's and doctorate degree in physical therapy from the University of California in San Francisco and completed a master's of public health from Johns Hopkins School of Public Health. Dr. Kaiser holds international experience in healthcare capacity building in India and multiple countries across Africa. On today's episode, we discuss how clinicians, educators, and researchers can improve health by reducing health disparities in individuals as well as populations. Okay, without further ado, let's begin and let's meet Dr. Laura Kaiser and discuss social determinants of health and disease. Hey there, Laura. Thanks for joining me this week on the podcast.
Hi, Joe. It's great to be here.
I'm excited to speak with you. For those who have purchased the book, Integrative and Lifestyle Medicine in Physical Therapy, or who are going to soon purchase the book, you penned the chapter with Dawn Magnuson on social determinants of health, which really, it's the first chapter of the book. I think it's foundational. It really sets the tone, not only for the whole book, but I think it also sets the tone for kind of integrative and lifestyle medicine as well. First, thank you for doing that and contributing to that important work along with Dawn. Just give me some background on how you became interested in this particular topic, social determinants of health, kind of in and around, the healthcare and physical therapy world.
Sure. I think it's something that I've really kind of always had an interest in, even before maybe I had all the language that I have now to describe it. Part of my background, I pursued a master's in public health, and that was probably the first time that I really formally studied this field. And so this was sort of an opportunity to kind of revisit some of the things that I had learned, during my studies, and really dive a little bit deeper into some emerging research around this topic, which there's really been a wealth of data and literature that's come out, I would say, in the last 10 years or so, that's really contributed to our understanding.
Yeah, I mean, the research around social determinants is exploding. Of course, the pandemic, I think, added fuel to the fire, so to speak. But as you mentioned, I'm not sure when you did your master's in public health, but it's been around for a while. It's almost like, I kind of feel like you mentioned terms. I think it was almost called something different probably a decade or two ago. And then as the literature has built, we, solidified some of the vernacular around, okay, these are social determinants. And the word determinant, if we could maybe just hang on that for a minute, because we hear all the time factors and risk factors and contributing factors. What's different about a determinant versus, let's say, a risk factor?
That's a good question. Well, I think, all of us in medicine have always thought about, what causes disease, right? So we often use that word cause. I think as we've learned, it's not that easy, right? So I think when we think about determinants, it kind of implies something a little more complex. It's not just, A plus B equals C, but it's, D, E, F, and G that are, kind of interacting at different levels to get a certain outcome. So I think the language has kind of been refined as we've really started to synthesize literature from a variety of disciplines as well. I think for a long time, there was different disciplines kind of operating in silos. So, maybe the field of sociology would start to pull something together, or the field of medicine, but there wasn't always, people weren't talking to each other. And now we've really recognized the importance of pulling this all together to create a better picture of what leads to or helps us to develop our health and function over time.
And as you're going through a master's program in public health and you're starting to be introduced to these concepts, are you kind of, are kind of alarms going off with regard to our profession specifically of physical therapy? Or are you starting to say, wow, this really speaks to some of the work I'm doing with women in the world? What was kind of happening in your mind at that time?
So I would say two things. One, what I loved about my MPH program was that I got to just take a little bit more of a bird's eye view. And I do enjoy reading about policies and just kind of these bigger things that you can kind of pull together in your clinical practice, but you usually are just doing one-on-one treatment. So that was really interesting and exciting to me. But I also felt like so much of what this topic kind of is highlights is stuff that we actually already do as physical therapists. I mean, so much of what we do is evaluating someone's environment. Maybe we're not thinking as in depth as this chapter goes, but we are thinking about who's there to support this person. What's their job duties, things like that. I think can be helpful, because this is a little bit of an overwhelming topic. As I reread the chapter, I was like, there's a lot in there. It can really packs a punch. But so as not to get too overwhelmed, recognize we actually already do a lot of this stuff. And now we just can kind of layer on this, additional information and research that we have.
How have you started to integrate this into your physical therapy practice?
So currently I've stepped away from clinical practice just in the last 2 years, which was a hard decision to make. And I'm really, I would say, leveraging both my clinical expertise and my public health background in thinking more about kind of like a health systems approach. So I've worked globally with a number of nonprofits where we're looking at capacity building, certainly working one-on-one with physiotherapists and other providers, but thinking a little bit more about the system and all the factors at play there, so that we can improve healthcare delivery.
And are you teaching some of this content in a PT program at this point?
Only a little bit. I'm on faculty at Andrews University, so I've done a few guest lectures, and then I've taught like a human rights course and a leadership course. So we've certainly embedded some of this, but not an overt class that's just on social determinants of health. So I don't know if it exists yet. Hopefully they do.
Well, someone will come around after this interview and say, this is an important topic. But, so when you're looking at the evolution of this topic, evolution of social determinants, which it is starting to show up, obviously, in PT programs, in some of the frameworks that we use. What framework specifically does this speak to that are potentially maybe embedded within DPT education or DPT practice?
Yeah, I think that the introduction of the biopsychosocial model, I think that's something that's I think most PT students now have been immersed in that. And that's not a bad thing. It certainly is, speaks to the factors maybe at a very individual level that, and it acknowledges it's not just biology, right? But it's these social factors and your mental health as well. I think what, the leap needs to be made is then, taking a little bit bigger, right? Thinking about, one, how does health develop over time? So from birth to, all the way through old age, and then just thinking a little bit more about this kind of multi-level perspective. So outside of this individual, what are all these spheres of influence from family, community, the country that you live in, even, things like that.
So when you say over time, you're talking about the kind of the life of an individual, so to speak.
Yes. Mm-hmm.
And so that right there can be big for a professional, maybe a physical therapist who is seeing someone, not always, but typically for a more defined period of time, is kind of more that life course view of health. And are you kind of approaching that more from, we can use this to actually improve treatment for a patient, or is it more from like a health promotion perspective?
So that's a good question. I think, certainly the health promotion, I think, perspective is a little bit of an easier sell there. I don't know. In terms of treatment, I think that it can certainly influence our kind of expectations, or our expectations for treatment outcomes, and maybe guide treatment in such that you might identify that this person might not be ready for PT. Maybe they need some kind of case management, some kind of community resources, and you can provide that, or provide those linkages to resources in their community, or work together as a team so that you're able to identify, what other things this person might need. Or maybe you can provide that as a PT. But I think it really pushes us to work together with, multidisciplinary teams. I think no one person can tackle all of these issues, but and I think that's a great thing. And I've always loved interdisciplinary collaboration in my work, and encourage, students and other PTs to take that on. I think it's more fun and also leads to better outcomes for our patients.
And when you say expectation, the expectation you're referring to is the expectation of the provider, if I'm kind of tracking with you here.
Mm-hmm.
Right. So explain that to me. So someone comes into you for physical therapy treatment, and maybe you're aware of a particular social determinant that they have. How would that impact the provider's expectation of the outcome? So, and is that expectation potentially, could it influence the expectation in a positive way and then maybe a negative way?
I think that there's both possibilities, and that's a great point. I think, so I was at Johns Hopkins for about 5 years treating a variety of patients, but we were nested in Baltimore City and had a large Medicaid population. I did a lot of sort of individual advocacy for certain patients where I just knew this patient's going to need a longer course of therapy because there's just so many things going on in their life. And so, educational barriers or just I have to spend more time talking to them, maybe, just that alone. And that has value. We don't need to just jump into exercise, but I need to, get their buy-in and help understand what their experience and what their goals are. And so often I'd advocate, for maybe a longer duration of therapy for, if a chronic condition, maybe up to 6 months. It wouldn't be that person that comes in that's got everything's great in their lives and then they just need, a few sessions or something like that. So I think it could go that way. But you're right, it could also feel overwhelming for some providers where they feel like, they may discharge them too early because they feel like, oh, they're non-compliant or something like that. So that's something I think we have to check ourselves and, really think through, I've seen it. I'm sure you've seen it too, where people are like, oh, this person's just not compliant. They're not coming to therapy. And, I would advocate with even my managers at that time to say, look, I know you want me to discharge this patient because they've missed 3 visits, but they take the bus or they walk, 5 miles across town to get here. And so there's reasons that they haven't been coming. And, and certainly at some point you do have to, maybe you do have to discharge that patient. But I think being able to understand those things rather than making some of those judgments without that kind of understanding.
Yeah, so there could be some bias there that when you take into consideration a social determinant of health, it could negatively impact, let's say, someone's clinical decision-making if they're not aware of the bias that they have when they approach the patient and the care plan.
Right.
That's really interesting. It's really interesting to think about that.
It is actually. I hadn't really considered it until you brought it up. But I think important also not to see this as like fatalistic, like because you had all of this stress in your life and all of these social factors that are not really conducive to your health. You're just doomed to have whatever it is that you've got. But to see that if that person wants to change or if you can help create opportunities for them to build a healthier life, that there is still hope there. It's not just a fatalistic kind of course.
Yeah. You mentioned the chapter that you mentioned. It's quite dense. I mean, there's a lot of great information in that chapter, and it's a lot to digest if you haven't really been introduced to social determinants of health. And as you mentioned, the biopsychosocial model, right? That social part obviously starts to pull in these social determinants into the whole conversation that we're having. And PTs are very aware of the biopsychosocial and the social aspects. However, can you make the connection for us on how the social part, because almost like the social feels like, well, it's in the environment, it's quote unquote, almost like far away from anything that I'm interacting with in the clinic. Can you give us an idea or explain to us how the social, which is outside our skin, right, actually can get under our skin and impact our biology and start to make that biosocial psycho connection?
Yeah, absolutely. And this is where I think this is really where this field of research has kind of taken off now that we've got a lot of data to show that connection. So, prior to this research, we sort of, we had really the biomedical model, right, where it was just, kind of mechanistic. And then maybe we talked about social stuff, but it was kind of over here. But now we actually have data that shows that our experience of our physical and social environment very much affects our physiology. And so exposures, we all have stress in our lives, right? And so we all, adapt to stress in our, day-to-day, and that's how we are, functioning humans. But someone that's exposed to chronic stress over time that really doesn't go away, that can give rise to kind of dysregulation of these different physiological processes that then, actually we have from animal studies, we have evidence that certain areas of the brain actually shrink. And then that gives rise to, states like chronic hypertension or cardiometabolic diseases, chronic pain, and then even like learning and behavior deficits and things like that.
So you're talking about, in some way, allostatic load and how that impacts someone's health?
Correct. Yeah. So the term allostasis actually means achieving stability through change, right? So it's kind of the body. We're kind of familiar with the term homeostasis. Well, allostasis is kind of the way the body gets us back to homeostasis. So it's not a bad thing, right? Something stressful happens. We're all familiar with sort of the fight or flight kind of scenario. That's a good thing, right? You need to run for your life, so so to speak. But then we also need a period where our body gets back to baseline. But individuals that are exposed to an abusive home environment or gun violence violence in their neighborhoods and maybe inadequate schools and all of these things, that over time has this cumulative effect where that process of allostasis kind of becomes maladaptive.
It's interesting because there's a lot of focus, I think, on really, people call them psychosocial variables, but a lot of times they're really just talking about the psychological variable. I think of course, it's wonderful. I've been, a big proponent of, psychologically informed care, but really what you're starting to talk about with social determinants is socially informed care. And how, you can maybe take into consideration fear or fear avoidance, let's say, in someone who has chronic lower back pain. But if you look even further upstream to that, there might be a social determinant that is potentially carrying more weight in that person's lived experience, which then affects stress mechanisms and pain mechanisms and trauma mechanisms, and really their ability to thrive in their environment.
Absolutely. Yeah. 100%.
So we have this biopsychosocial model, using it in PT practice. How would you like to see professionals start to implement more of the social into their practice while still taking into consideration the biological as well as the psychological?
So I have a couple of thoughts. One, in terms of resources, there's actually some resources in the chapter that really help a clinician or even kind of a group of clinicians to start to evaluate social risk factors that their patients are experiencing. And a lot of those resources will then kind of guide either a linkage to a community resource or something like that can help. Because we certainly don't expect that physical therapists are going to be addressing food security issues, for example. But we can certainly be familiar with what resources are in our area to then help with that particular stress.
So you can screen for them first.
Exactly. So in
the evaluation.
So I know American Academy of Family Physicians has I think it's called the Everyone Project, where they're like kind of promoting this team-based approach to addressing social determinants of health. And even Centers for Medicare and Medicaid are starting to embed some of this. So we are seeing a shift in practice in this way.
I've seen that CMS has some type of, it's like an evaluation tool or screen. And I think parts of it maybe have been validated, but I know they pull from other places. Have you seen that assessment form?
I have. I want to say they launched like a 5-year initiative. So I think it's done, or it's finishing this coming year. I can't recall the dates, but my guess is that they'll sort of take all of that and then come out with their own sort of tool. But it's really great. I mean, it's great to see that they're recognizing, all the things that are affecting health outcomes.
Yeah, and what they have right now is pretty simple. I think it's like 10 or 15 questions potentially.
Exactly.
So I can't imagine it'll be much longer than that once they're complete with it.
I don't think so. I mean, I think for most of us in healthcare, unless you're a social worker where you want to do an hour-long intake and you want to really get into the meat of it, I think 10, 15 questions, something that, you add onto your intake form can really help. And you can just take note of it. And again, kind of, it can inform some of your clinical decision-making or just the resources and things that you offer.
Right. Because so you mentioned social worker. Like, I think people say, well, this is what a social worker does, so to speak. And it's like, well, yes, if you have someone who has multiple social determinants of health, then obviously, an entire clinician could spend time with them working on those. But there could just be one, let's say, that you might have to be aware of in your evaluation and treatment that might actually improve your outcome.
Absolutely. And I think something to keep in mind, I like to speak to PTs about really shifting our perspective on how we practice PT, right? It doesn't always have to be one-on-one. We could really start to think about how we can embed ourselves in the community, or, and I'm not saying we become social workers or we become psychologists, but there's a lack of adequate healthcare providers in this country and around the world. And I don't think that's getting any better, unfortunately, for at least the foreseeable future. So being creative in how we're, helping our patients, delivering care, and then collaborating across disciplines when we can.
Yeah, I love that train of thought and that vision, because it really tells new physical therapists or maybe existing physical therapists that there are opportunities beyond the one-on-one treatment approach.
Right.
If you want to venture into other areas where you start to look at groups of individuals or communities or potentially even whole populations, and how your knowledge and your skills can be used to better serve them.
Absolutely. And, we know burnout's high, with the kind of the traditional clinic model. So as much as it's, scary to kind of leap into some kind of uncharted territory, I think it's exciting too, and gives us real opportunities to show up and to show other professionals like this is what our expertise is. And, we don't just need to see our patients one-on-one, though that is still very important and will remain important, but we can get a seat at the table to decide, all kinds of things depending on, what our interests are and what kind of we're facing.
even though they're called social determinants, there's a part of this that is wrapped up with political determinants or socio-political determinants, right? Because in many ways, the policies inform public health, right? You know that. You have a master's in public health. How much of that do you start to say there are really opportunities here for physical therapists to engage with policymakers, engage with government, engage with very large corporations that potentially have influence over certain communities? And where's the opportunity for us there as physical therapists and other health providers to use our knowledge with that group?
I think that we're just kind of at the tip of the iceberg there. And I love to see, and I am seeing more PTs kind of jumping into those arenas. I think 10 years ago, when I would talk about advocacy, no one wanted to talk, because you thought, oh, I have to go to Washington, D.C. and lobby or something like that. And you can do that. And if that's what you want to do, I highly encourage people to do that. But there's a lot of other ways that you can have influence with, even your local government, or if you're working in a hospital system, pushing your way up to some of these positions where you have some decision-making power, some influence over the decisions that are being made. And I think that there's also increasingly an interest from, large businesses and things like that, because they're realizing that it's costing them money to not be addressing these things.
Right. And that might be the biggest factor in why people pay attention, because there's a major cost driver in all this that both big government, local government, and private business are starting to look at this and saying, every year, my health insurance premiums go up, let's say 20 to 30%. How can we start to address that in a way that will not only obviously impact our individual health, but may impact the greater collective, so that cost comes down and it has an impact on people's pockets?
Right. Absolutely.
So then that starts to point people into the direction of, okay, once you understand the social determinants, then you could go into things like not-for-profit organizations and find a role or a leadership position there, talking to your local government about these topics and how it impacts health and what your knowledge is, maybe a local school system or a local business. And those are topics I don't remember ever talking about in physical therapy school. I remember, from what I remember, it was, well, there was a lecture on how to start a private practice, which was, relatively small, but no one said that you could actually take this to kind of the bigger community or population level, which I think is really what's interesting about this.
Yeah, it's obviously a topic I'm very interested and passionate about, but you're right. I mean, it was not anything that I learned at all in PT school. It wasn't until really some of my global health work where you saw so many patients, and you'd be working with literally one physiotherapist to treat everything in a tertiary care facility. There was no way she's ever going to get ahead. We've got to think about other types of policies and things like that to reduce her burden and improve, health for everyone.
Yeah, and you've started to do some of this work on a bigger level with the company called, the website is themamas.world. Tell us about that. People can, of course, go and visit it, but tell us about it.
Sure. So my colleague, Jessica McKinney, she is another physical therapist. She and I actually met. I lived and worked in the Eastern Democratic Republic of Congo for about 2 years, and I continue to go back. This was, 14 years ago now. But we actually met there and really just kind of had a shared passion and vision for this type of work, really focused on women's and pelvic health in low and middle income countries and low resource settings. Over time, we were starting to get engaged with some of the bigger nonprofits and USAID and sort of formalize our partnership under Mama LLC. We chose to go that route rather than a nonprofit for frankly ease. At the time, we just thought this, and we also, we needed to make some money doing this work. It wasn't all volunteer work. And I think that's an important point. Volunteer work is great, but we were really committed to driving this as some of the main focus of our work. And since we've, I would say our biggest partner to date has been Engender Health, which is an international NGO that receives a lot of USAID funding specifically for women's health initiatives around the world. And we've really been able, right now we're working in Nigeria, and we're working with their Ministry of Health and their kind of National Social Work Association, and then their National Center for Population Health to think about, how to kind of build capacity for rehabilitation services, knowing that there's not enough physical therapists there. So working with community health workers, working with nurses, kind of social workers, things like that to start to deliver pieces of care, depending on the scenario.
Right. So you've applied kind of what you've learned from the social determinants and your background in public health to essentially women's health or pelvic health for a whole population instead of just, let's say, seeing individual people.
Right. And that's often, it's funny. I was just on a call recently and it was like, wait a minute, like, I think you don't understand what the work is that I do. Like, I don't just kind of go to Africa and treat patients. I mean, I do a little bit, but rarely actually. I really try not to just see patients because that doesn't feel like a sustainable model. I'm always working with providers or even at an administrative level to think about, kind of how to roll out a program.
That's pretty amazing. Have you thought about kind of modeling that program here in maybe parts of the US where there are women or individuals with pelvic health issues that are underserved?
We have. It's hard, as you can imagine, but we definitely have, and that's very much our vision. And I think if you see our website, we've both done work in the United States as well, and this work in primarily in sub-Saharan Africa, and we really just see it as a continuum. It's not like, oh, all these poor women over there. Like, there's plenty of kind of poor women over here that are suffering and experiencing all kinds of pelvic health conditions. So we've kind of percolated on some ideas, but we haven't quite gotten the resources to grow it too much.
Yeah, I can see like a pelvic health, pelvic healing collective or a pelvic health collective as a way to educate and empower women with their health and wellness. Which I think is incredible to think about, that you can take all the skills you learned throughout PT school, maybe working one-on-one, and then boom, it's delivered to a much larger demographic.
Right. And one thing I actually haven't mentioned is I also have kind of a foot in digital health. And I think that's where I see, especially in a place like the United States, I have done some work there. We just haven't quite grown in the ways that I envision. Maybe in 10 years, we'll have this conversation again and I can tell you all about it. But I think digital is certainly not a replacement for any in-person care, but something that can really leverage, or help scale up, things at a population level.
Right. We've already seen some of that in musculoskeletal health, chronic pain, chronic low back pain, arthritis, and some of that has been very successful. And I think you're right. We'll see some of that spill over into probably every other aspect of physical therapy, because really everything that we do as professionals has an impact on someone's long-term, as you mentioned, their life course, their health and well-being long-term.
Right. And that's something that I think, we need to kind of get on the train as physical therapists, because someone else will do it and it won't be as good. I feel like, when you come in and you say, oh, but this could have been so much better because I have all this knowledge, but kind of the business folks, they don't know what we do unless we tell them. So I certainly encourage all of our listeners to think about that and strategically in terms of what your role could be. Yeah,
well said. In a lot of these areas, we can really be the leaders and really managing the system to make sure that it's evidence-based and obviously is helping the intended population that we're intending to help. Laura, it's been great speaking with you about social determinants of health and disease and some of your work. How can people learn more about you and follow all the things that you're doing?
Sure. So I'm pretty active on LinkedIn. So I often encourage people to find me that way, and as well as my website. We are going to migrate soon, but you can still find us at themamas.world and kind of access some resources actually through that website as well.
Great. So once again, you can reach Laura at her website, themamas.world, or you can find the links that we mentioned today on the show notes at the Integrative Pain Science Institute. You can reach out to both Laura and I on social media. You can find us definitely on LinkedIn. I spend a lot of time on Instagram, where you can find me at Dr. Joe Tatta on Instagram. Again, I want to thank Laura for joining us this week to talk about social determinants of health and disease. Make sure to check out her chapter in the book, Integrative and Lifestyle Medicine in Physical Therapy, which you can find on the website at Amazon or at optp.com. Thanks for joining us, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.